What's going on, everybody? Welcome to the Freedom to Flourish podcast. I am one of your hosts, Dr. Tim Augustiniak, here with a good friend and colleague, Dr. Joel Miller. And it's been a minute. We took a little bit of a break, and it wasn't necessarily intentional. It just kind of happened. So it's funny.
Yeah.
I was telling patients a couple weeks back, oh yeah, I'm going to be in Dallas this coming weekend. We're going to do an in-person episode. It's going to be great. It's going to be awesome. And then I'm in Dallas. My sister got married. So Dr. Julia, who was on the podcast previously, got married. So I was in town for her wedding. And for those who maybe haven't heard the whole spiel and everything, Dr. Joel practices and lives in Flower Mound, Texas. So it's a North Dallas suburb. And my sister lives and practices in McKinney. And at a good time, they're 45 minutes away from each other?
Yeah, with no traffic.
Yeah. Well, I GPSed it and it was showing like an hour and 15.
Yeah.
And there were some accidents and stuff one way for that length of time. And so given the festivities and seeing my family and all that stuff, we decided to forego an episode that week because I just needed to spend time with my family. So
for sure.
We did that. And then we were supposed to do something on Sunday to then have the episode to post yesterday, which would be, Monday the 3rd. But something came up and we just were like, all right, well, I guess we're missing 2 weeks in a row. So unintentional break. So glad we're back.
Yeah.
I think to see you again, Dr. Joel.
You too. I'm so glad to be here. And to our credit, I think that's the first time since starting the podcast here that we've actually gone 2 weekends or 2 weeks back to back without recording here. But, we've been pretty consistent, which has been super cool. And anyways, I'm excited for us today. So Dr. Tim, give us an intro here. What are we getting into today?
So last night, I was scrolling through the health related Instagram videos, and there's this medical doctor who he likes to rip on all sorts of chiropractors, all sorts of natural health practitioners. And I have to say, in a lot of circumstances, I actually agree with them. But in other circumstances, it's just truly not understanding the scope of practice that we have as chiropractors. So I think it's rooted in ignorance more than anything. But with the thing that he was talking about this practice group that I'm going to leave them unnamed, just not to directly rip on anybody and cause any problems. But this practice group is a pretty decent size. They do functional medicine, but their training is rather internal. We'll put it that way. So they have a lot of docs that kind of compile stuff together and everything. But I would argue that given their modalities of assessment, they lack in challenging ideas and reproducibility of their results. And so the whole reason that we do things the way that we do them is you can try to poke holes in it all you want, but at the end of the day, it helps people. It helps people. And the applied kinesiology, there's a system of checks and balances where you will get to one answer, period. And if you want to challenge that, I mean, the doc that we train under, Dr. Steve Gangemi, he says, if you have questions and you want to question it, I challenge you. I will absolutely back up all of my claims with evidence from patients and with evidence using the muscle testing. And so he also has labs and things like that will back up his claims, research that will back up his claims. And so it is grounded in really good things versus the stuff that this practice group does. I've got some friends and colleagues who've worked for them and done some applied kinesiology and things like that, where their ability to problem solve and their knowledge beyond what they're trained in is exceptionally slim. And so anytime a patient doesn't fall within the normal, expectations and the normal care plan, they don't know how to problem solve. Right. And so it's just like, okay, our typical path that we take with patients, if that protocol doesn't work with you, I don't know what to do. It's just, at that point, you're just kind of screwed as a patient, which that's no good. But there's internally there from the top down, there are exceptional incentives to sell patients on care plans and to sell them on these big, long protocols where they pay for a ton of stuff up front. And it's really pricey. They make a ton of money off the labs and everything. And so with that being the case, I don't really believe, hearing from numerous individuals who've worked for them, that things are rooted in probably the best moral motives behind providing care to patients.
Right.
At the end of the day, you run a business, I run a business, and of course, money is an incentive. But at the end of the day, I would argue we do not sacrifice our morals for the sake of making money. I really, really try to put patient care at the forefront of my recommendations. And I
Yeah.
actually feel like a lot of times I'll sacrifice recommending things that I feel like I should, because I can tell somebody feels like they're perceiving me to be motivated by selling things as opposed to the
Yeah.
actual care. So I try to
Right.
be really minimal with supplements, try to be minimal with lab testing that's expensive. I try to make it as economical as possible, while also, I mean, we spend a lot of time with people, and so it has to be
Yeah.
worth our time to do so. We've got student loans and all kinds of stuff. So anyway, with that being said, the whole goal of the episode is to talk about, well, what sort of things are these people using to scare patients into doing these care plans, and what things were found in this video that, one, I agree with the medical doctor who's kind of ripping on them for it, but then at the same time, what are the things, I guess, the argument on their side that kind of supports the functional medicine side and what they were getting at. So
Yeah.
anyway, I think there's a balance to be had, and you need to have really good reasoning behind what you're doing and not just spew garbage for the sake of scaring somebody, because
Yeah.
then not only does that, I think, come off bad morally, ethically with patients, but it also um, it comes off bad in the whole integrative healthcare setting. It
Yeah.
doesn't help our clout with other practitioners when we're already kind of on the fringe anyway.
Yeah.
Medical doctors really don't like hearing alternative stuff in the first place. So if you're doing stuff that doesn't really have any legitimate clinical backing or decent training or reasoning behind it, it just doesn't support them wanting to work with us, And I mean, at the end of the day, the world that we live in, you have to work with other people. For the most part, people go other places, then they come see me. And I feel like I'm kind of on an island here in Arkansas, but that doesn't mean that I basically say screw other doctors. I'm happy to try to fix the problems that they've presented or the lack of solutions that they've presented to patients. At the same time, I really think most doctors do the best that they can. So I don't think there needs to be kind of a clash there and ripping on each other. So
Yeah.
anyway,
Man,
that's kind of
there's so many things.
my take, and
That's
that's
good.
what we're going to get into.
That's good. There's so many things, and we could turn this episode into so many things. It's like talking about muscle testing in general, and like what should be the best healthcare approach to patients, right? Spending more time, spending less time, doing more labs, doing less lab, doing more muscle testing, less muscle testing, and so on and so on. You have that conversation, and overall, like, the legitimacy of muscle testing. I don't have people that bring that up too often, Dr. Tim, similar to yourself, because I know that you have a wait list and we have a wait list here. So a lot of times when patients get in, they're like, hey, I believe you can help me, tell me what to do. And we just jump into things. But like every few months, I might get somebody that's like, okay, is muscle testing legit? And it's funny because, we can talk about research, we can look up different case studies, we can look up and see kind of what research has been there. And recently, it had been a while. And so I was trying to explain to this patient that, we can look at it and we can kind of talk about that and the good parts of the research that's out there and the bad parts of the research, and how every patient's so unique. It's hard to have double-blind studies on some of this stuff. But the biggest thing I told her was, like, the biggest thing that sold me was actually seeing it benefit me, like, real time. And so she literally laid on the table, and one of the things that was bothering her was her shoulder was hurting her. As we worked on things, there was like a spot on her shoulder that we needed to work through fascial wise. There was a spot on her calf. We worked through those things, and like her shoulder pain went away as we worked on things in a span of like 10, 15 minutes. And I was kind of like, okay, do you believe it now that muscle testing's, legit and stuff? So it was kind of fun. But we've got that topic. We've got this whole topic of like, okay, there's a ton of financial incentive for practitioners, especially when you're in your own business. So it's like, from our perspective, it's like, how do we keep ourselves grounded, and how do we keep ourselves putting the patient first? And we can definitely get into that, because I'm sure we can talk. I'm sure we have different stories on those things. And then we also have this topic here of like, okay, how are other docs and other practice groups, how are they trying to sell people? What's the information they're communicating? Kind of what are their tactics? And then what's actually like true? in the midst of this, right? So and I think this is where we'll get into a lot of this stuff, but it's kind of like, okay, they say, oh, you've got inflammation. Look at this test or look at this image. You've got so much inflammation. If you keep on this route, you're going to be in a wheelchair by the time you're 75, and I don't know if they say that, but I'm sure people tend to kind of go along that route with things a little bit. And obviously there are some things there that are true and then some things that are not true. And so kind of talking through some of those things. So Dr. Tim, obviously we can go anywhere with this one, but I know that we are kind of wanting to go towards kind of talking about like, okay, the different approaches, different techniques that different docs will use to kind of try to kind of sell people on different packages and stuff. Is that kind of what you're wanting to get into? And then with that, like, let's just kind of talk about like, okay, what's kind of their approach, I guess. And where do we feel like, man, that's not really the best way to go about things?
Yeah, for sure. Well, let's start with like, what are the buzzwords or the scare tactics, kind of the combination that I saw in this stuff. Yep. So this video, a lot of the docs within this practice group were talking about how they were doing x-rays. They were doing like full abdominal x-rays and what they use as an indication is stomach troubles, thyroid issues, a couple things like that. From the little bit that I saw within the videos, this is what it seemed like. They were using indications for maybe some IBS type symptoms, bloating, stomach issues, cramping, constipation, diarrhea, whatever. And then from there, some thyroid issues, presence of some issues on thyroid labs. And within a clinical setting, using best clinical practices to, shave off costs and make it as cost effective as possible, which that should always be a goal, especially when doing imaging and things like that. I don't know about you, but I would argue that there's no indication there for abdominal x-rays. If there is some sort of IBS symptoms, things like that, unless you just haven't gone to the bathroom in weeks and you're trying to see if there's impacted stool, it just doesn't make sense for best practices, in my opinion, to do imaging like that. And that's back in school, we had the guys that taught our radiology classes were taught by the guy, Dr. Terry Yoakum, that wrote the Yoakum and Rowe radiology textbook that all medical schools use.
In radiology schools.
Yeah, exactly. And so they're world renowned doctors. They're phenomenal at what they do. And so going through that training, that's not saying that we're that good. Absolutely not. But we were trained by people who are really, really good at what they do. And nowhere in any of the training was any sort of indication along that line for, let's just do a full abdominal x-ray for this. There are certain circumstances where imaging is acceptable, but they're all about, they would shake their heads at us doing applied kinesiology. They are just so, I would argue, very medically oriented in the way that their clinical thought process goes. It's very like, all right, adjust, rehab, and imaging when necessary. And that's what we're going to do. And if the research doesn't prove it, then we're not going to do it. And we would argue that although the research in regards to the little nuanced things that we do in the office may not quite be there yet, it is headed that direction. And we're kind of pioneering the techniques that, if it's not like there was always research on why people were doing things, there's trial and error, and then there's research to support what you're doing as things go. And then you modify your clinical practices as research proves to be effective with certain methods or not. So, but anyway, in the video, they were saying, okay, well, there's all this gas, there's this inflammation that's present on this abdominal x-ray. When x-rays, what are those mainly to view, Dr. Joel? What can you see on x-rays effectively?
Yeah. So x-rays are going to be way less specific in detail compared to like a CT or MRI, but in general with the abdomen, docs are usually only running x-rays to check for, you mentioned it, but basically constipation, if there's a backup of stool. The other reason for x-rays really is just look at any like obvious bone issues, fractures, things like that. Like those are the main things. If somebody's like trying to really diagnose and get the best image, nobody's running an x-ray. Yeah. They're going to look at CT, MRI, but even with those things, I would argue, to your point, it's not a perfect world that you're going to really be able to see like signs of inflammation with the gut and stuff like that. And especially conditions like irritable bowel. syndrome, where it's a condition that is basically just based off of symptoms. It's not something that you can see on imaging, to your point with that. So yeah, abdominal x-rays, looking for any obvious like fractures. Obviously, if there's any obvious like tumors or something crazy, you should be able to see something like that, but not usually in the best detail, but anything obvious.
Yeah.
And then of course any severe like constipation issues.
Yeah. The most obvious thing that we're going to be able to see on X-ray is osseous structures, so bone. So that's what will appear bright white when we're looking at X-rays. And so, like you said, if you're really looking at soft tissues and all that stuff, CT, MRI, ultrasound, all those things are going to be most effective. Now, say you have gallstones. I mean, those are calcified, so you're going to end up seeing those. If you have different calcifications of certain organs, you could see that. But the thing is, a lot of times things calcify and there's no real reasoning for it. It's just a benign incidental finding. And that's another thing where the radiologists that taught us, they use this term called catastrophization, where basically if you see something that is an incidental finding that has zero impact on clinical outcomes on your imaging, as a patient, if you go, oh my gosh, I've got gallstones, but I have zero symptoms of gallstones or have zero gallbladder pain, zero digestive issues, anything like that, all of a sudden the anxiety and the stress that you can get from that a lot of times will hurt clinical outcomes.
Yeah.
And so same thing with like bone spurs, things like that. If somebody's like, ooh, yeah, my symptoms are due to a bone spur, I'll never be better. Or I've got a little bit of, calcification and basically kind of fusing of these joints. I'm never going to be able to move properly. It's this quick downward spiral of positive thinking within care, because there's, even outside of our model, there is the physical, there's the emotional, and there's the chemical aspect of treatment. You have to move properly, you have to be healthy in that regard, you have to eat properly, you have to supplement or medicate properly, and then you have to have positive thoughts, because that so heavily dictates things. But anyway, with what we were, at least what this video showed, they were just like, oh yeah, normal bowel gas is what they were seeing if you were looking at imaging. And I'm not saying that the patterns that I observed in this video were terribly normal looking. Some of them looked like, yeah, there's quite a bit more. But like you said, there's no inflammation that you can see. Yeah, you could say, okay, well, maybe there's a microbiome imbalance that's causing excess gas. Maybe there's some constipation that's causing excess gas. Maybe there's some microbiome imbalance that's leading to inflammation that could be causing that. There could be, say, like a food sensitivity that's contributing to gas production, maybe a gluten sensitivity causing that. But at the end of the day, the imaging, it's impossible to see actual inflammation via an X-ray. And so I think to put that in front of a patient, on your board, and say, here, this is your little pocket of inflammation here, a little pocket of inflammation here. It's like, it's a fart, it's not inflammation. At the end of the day, it's just, it's bowel gas that can be totally normal. And yeah, will that move as we're working through maybe treating somebody's microbiome? Sure. I'm sure that you're going to clear gas and clear things out properly, but that's not inflammation. And in our world, I mean, how many times do you have a patient come into the office saying, oh my gosh, I've got so much inflammation. Oh my God, it's terrible. And they are just these head cases about all this stuff, Sorry if you're listening and you feel like you fit that category, but there is the buzzword of inflammation that scares the crap out of people.
Yep.
And so I think that that's kind of a predatory practice of being like, ooh, yeah, you've got, this going on, and based off of maybe your thyroid labs, this could be, in your environment that's contributing to that. And I think that that's connecting dots where there's no actual line between them.
Yeah, there's no indication.
Yeah, if you've got like a functional hypothyroid and you've got some thyroid issues, and you've been on medication for a long time, of course you need to look for underlying drivers of stress and inflammation, and maybe nutrient deficiencies that lead to conversion issues and autoimmunity and all those things. But that's not, X-rays are not going to say this is tied to your thyroid. It's very heavy allusion to problems with that. So anyway. That's kind of
Yeah.
what the video was showing, and I just it kind of bugged me because I mean the medical doctor that was ripping on them, I'm like, yeah, honestly agree with you. I don't think that posting a video on social media saying this is helping build any sort of legitimacy with anybody other than patients who are ignorant just because they're not trained, you know. And so I fully agreed with him with that, but then he was saying like, you know, scope of practice, you know, you just adjust things and that's it, and that's completely false as well. So I think both sides there's a little bit of I guess lack of information, we would say.
Yeah. Yeah. There's and I would say like this kind of conversation we can open up to a lot of other things, right? So the buzzword of inflammation, and then doing like an x-ray of the abdomen and kind of being able to say, and there's a lot of other, like obviously there's other imaging, there's other tests, there's other things where yes, people, different practitioners can kind of jump into that with a lot of emotion and um, and kind of almost increase like a component of fear, right? So where it's like, okay, we run a blood test and it's like, oh my gosh, this is what I'm seeing. I think you've got some nasty heavy metal toxicity, and you've got this and this and this and this and this. And it's one thing if, you know, if it's true, but I think it's a whole entire other thing. And maybe this is the bigger takeaway from some of this. It's a whole entire other thing of like, what's the heart posture of the doc and how it's being communicated, right? So I'll tell you, Dr. Tim, if I ever go to a practitioner, let's say I'm going to like my holistic dentist or something, if I ever like feel like there's a sense of like fear kind of being pushed, I'm like, no, thank you. I disagree with that. And I know that whenever there's any kind of fear like being pushed in that, I know that's not coming from like a good place. And I've never felt that from my dentist, you know, just to be clear. But but I think that that's a kind of a valid takeaway, an important takeaway for our listeners is like, yes, hear what the person has to say, no matter if this is your doctor, your dentist, whoever this is, hear what they have to say. But also kind of critically think, and don't be afraid to research, and, you know, figure out what are the important questions to ask, and then ask them those questions, and they should be able to answer them. And again, be able to display honesty and to be able to display, you know, that they are knowledgeable about the topic with things. So it's kind of an interesting point. Like you said, again, the abdominal x-ray is important, but we could take it to so many other things, Dr. Tim. And I mean, what are there any tests, Dr. Tim, that come to mind for you that you're like, man, we see a lot of the practitioners run these tests and they kind of come to these conclusions, but maybe it's more salesy than it is like helpful for the patient. Does that make sense? I know it's kind of a big question.
Yeah. Well, I mean, I would argue functional medicine as a whole can be very salesy in that regard in all sorts of different tests that are run. I saw a clip the one day, this was a while ago now, and I think I've mentioned it before, that I don't even remember who it was. It was just a random clip on social media of some functional medicine podcaster who said, functional medicine has devolved into an expensive guessing game.
Oh, you know, wow.
I would argue initially it was intended to kind of get us back to our roots in physical exam, assigning organ systems to symptoms, and developing your, I guess, clinical thought process for your differential diagnosis.
Yeah.
You know, what the potential root causes be, instead of just this condition, you know, this condition, this condition. Conditions are not root causes a lot of times. Conditions are a culmination of symptoms that have something that's fueling it. And so the whole goal is to find the thing that's fueling it. Yet, in order to do so, the ability to do a proper physical exam and the ability to listen to a patient effectively, I would argue, are just as important as knowing what sort of tests that you could run. Because at the end of the day, if you run too many tests, it makes it way too expensive and not feasible for most people to access care.
Yeah.
And you need to have care that's accessible to people.
Yeah.
Maybe not everybody, because at the end of the day, we are not, you know, we're cash-based practice and we have bills to pay and we spend a lot of time with people. But at the same time, you can't make it like, I mean, during our DABC training, there was a doc who led a lot of the seminars and did a lot of the teaching. And I asked her, what does a typical new patient visit look like with all the tests that you run, cost wise? And she goes, anywhere between $5,000 and $7,000. And I think that is absurd. That is totally unreal to expect to build any sort of practice.
Wow.
Now,
Wow.
because she had the clout and she had, years of experience and clientele and all that stuff, she could do that. However, that's just not feasible.
Yeah.
Us being in our 20s,
And
there's just no way that we have any sort of authority and longevity of our practice life to have the ability to build something like that this fast. It just doesn't, there's no way. But with that being said, what sort of tests can be run that are just excessive? I would argue that stool testing can be very excessive a lot of times. So
I was thinking about that one. Yeah.
hey, you've got bloating, you got constipation, diarrhea, whatever it is. Oh, let's see if you have parasites, and then you'll see, okay, on the GI map test, maybe you've got some little bit of this kind of parasite. Say you've got a little bit of this microbiome that's high. I have never, even in relatively healthy people that don't have any gut symptoms, I have never once seen a test like that that's normal. Everybody always has something,
Yeah.
And so it's like, if everybody always has something, how is that a legitimate source of testing
Right.
to find problems?
Yeah.
I would argue if I'm Joe Schmo who doesn't care and doesn't have feelings and I just want to sell people and stuff, that's the perfect test to run.
Yeah.
Because that is the perfect test to say, hey, you got a problem. Let's sell you on this.
Yeah. We got to do this big old program and everything.
Yeah. We'll give you, $1,000 worth of supplements. We'll do it over 4 to 6 months. We'll check in, do our consults here and there to track progress. And then we'll do more of that testing at the end to see how things have changed. And it's like,
right.
Yeah, okay, so maybe it changes a little bit, but even still, if it's never truly good, even at the end of the road, if it can't go from bad to good, maybe kind of bad to kind of less bad, like that just doesn't. I don't think that's great clinical practice.
Yeah.
You have to have better ways of assessing and tracking things, and then, of course, be like, oh yeah, we reduced inflammation. There is nothing on that test that indicates inflammation. It just says there's the presence of these microbes. It does not tell you whether or not your immune system is reacting to it. Inflammation is immune system reactivity. Your immune system doing its job, fighting things off, producing immune system cells, yada yada. Or it's fatty acid imbalance stuff. So it is too many omega 6 is not enough omega 3s.
Yeah.
And so there's nothing on those tests to tell you inflammation. Yes, you can allude to there being inflammation if there's symptoms with it and everything, but there is not a direct, hey, something's present on these labs, you therefore have inflammation. There's nothing that says that for certain.
Yeah, man, Dr. Tim, there's so many things here. Cause think about, we're kind of going in on the holistic approach, right? And I think a lot of people, let's take the example of a first visit and all the labs and everything, anywhere from $5,000 to $7,000. If we think about that, but we kind of start with the perspective of understanding that most doctors today are medical doctors, and their approach is also very, very different. The medical approach is we're going to look at things. We're just going to look at symptoms most of the time. We're not really going to run that many labs. And we're more so going to prescribe things and try stuff. Right. So I hear stories all the time about how somebody goes to their doctor. Maybe their doctor is not really sure about what's happening. They might run a lab or two. And of course, when I'm looking at these labs later, I'm like, man, this isn't very thorough as far as labs. But then the doctor kind of tries something, and it comes across as very just inadequate. And then you think about that, and that's kind of the standard thing, right? Then you think about, okay, somebody comes across a holistic practitioner that is going to they're going to do kind of the opposite of all those weaknesses, but maybe even do them to an extreme. So instead of the medical doctor, not spending very much time with them, a lot of holistic docs are going to spend a lot of time with people. And I would argue we do that. I find that that's usually very needed. But on one hand, where the medical doctor is not usually going to run very sufficient labs, a lot of holistic docs will run an overwhelming amount of labs, kind of like we've talked about, right? And it's just I could see that being attractive to a lot of people that have been looking for answers. And they finally, let's say they come across, they've been to 5, 6, 7 different medical doctors that don't really run very many tests for them, and they don't they kind of guess with prescriptions and they don't really understand what's happening. Well, I could see if somebody comes across a holistic doc and is like, oh, this one's going to run every test and we're going to figure out everything that's going on. I could see that being super attractive. So much so to the point that people would be able to be willing to spend an arm and a leg to get that testing done and kind of to start that care. All the while, again, what we're trying to get back to is like, hey, there's like a middle ground here somewhere. There's a middle ground where certain tests are, certain tests would be definitely helpful. Sometimes certain tests are needed. And then sometimes you don't have to do those things. But yet some practices just kind of do those things because that's just how they're designed. And Dr. Tim, I think, again, to our credit, not to like toot our own horns, but we have spent a lot of time like analyzing our approach and our practice to the point that we've designed things and tried to set things up so that patients have, number one, the best experience, but that's not just from like a tableside manner. It's the best experience just from the beginning to end. Communication, transparency, like, okay, communication, what's happening, what happens during our first visit, all that stuff. Transparency of like, how much is this going to cost? What does this look like? How long might this take to fix these things? Like, we go through all that stuff. I know we both do with our patients, but then also in the moments of like really looking out for the best of that person. And to be honest, Dr. Tim, I feel like a lot of this could be just kind of broken down to like, hey, are docs trying to make money or are docs trying to help people? And that's like a huge, it's kind of a huge question.
Yeah.
So yeah, do you want to say something there?
Yeah. It's easy to just say, oh yeah, our way's the best way, but it's when we're digging into poking holes in different methods, you can try to poke holes as much as much. And honestly, there are holes, we try to be as thorough as possible, but there's holes in any way that you do things. I always tell people like, say you tell people, hey, this is going to take you 4 or 5 visits or so. And then they get in and you're at visit 5 and there's still stuff going on. Well, that's why you tell people you're just not in the 80% of people that it, ends up going that well. And it's a tough conversation to have, but at the end of the day, there's often outliers, and that's who ends up calling us, is the people that haven't been able to be helped by anybody else. And that's why we rely on the muscle testing to figure out what's going on, because it's different. It's a way of tapping into the nervous system that's completely different than any other technique. And so with doing that, we can assess things in a way that no other practitioner can. And so just for example, last week I had a follow up with this lady who she's just been dealing with just incredible low back instability. And we've been doing diaphragm rehab stuff. We've been doing all kinds of things. And we ended up finding that like when she was talking, things felt worse. I kind of just passively noticed that. But then as soon as she quit talking and her mouth was closed, things felt better. And so I wasn't getting like great results on things. Well, come to find out, her diaphragm became dysfunctional when her mouth was open.
Yeah.
Her TMJ, when she was just letting her jaw hang and her muscles weren't engaged, her psoas muscles just turned off.
Yeah.
And so we started working through things. And by the end of the visit, we actually ended up going, she was my last one of the day. We went 30 minutes long because I was like, we are getting really good, traction here. And we worked through a bunch of stuff, and we worked through different jaw positions along with testing her psoas muscle. And by the end of it, she literally got off the table and was like, oh my God, I haven't been pain-free in like years. And all of a sudden, bam, it was just done. But how do you assess that without using the muscle testing,
Yeah.
And so we use that for some musculoskeletal conditions, but also, for the example of like, oh, how do you check and see what's going on with the thyroid? We can assess the thyroid and see what organs are directly tied to it. We're not just taking not just taking pictures of your gut and saying, oh yeah, there's something on your gut. Let's assume that's tied to your thyroid. We are using the neurology to figure out exactly what's going on. And so all in all, to sort of wrap things up, if you go the natural route with care, I urge people to be kind of wary of people that only use words like inflammation and stuff like that and only rely on labs, because those are, I would argue, I don't want to say just intended to scare. I think a lot of it is people don't know what else to say about stuff. Oh yeah, there's just inflammation. That's just what people talk about these days is inflammation. But what is it and what's truly causing it? And what are the practical steps you're going to take to assess that and move forward? Because if there's no definitive answers that can be demonstrated and explained thoroughly in the process that this person is taking, it may not be the best approach.
Yeah.
If you can't poke holes and they can't answer questions based off of that, maybe find somebody else. Because I would argue that you, as well as I, we can defend our reasoning behind the things that we recommend more often than not. At the very least, even if we don't have a great answer biochemically as to what's going on internally, the before and after change with treating reflexes and using the muscle testing is a great tool to demonstrate that. So we at least have that to fall back on.
Yeah. I think it's great. I think there's a lot of different things that could potentially be taken away from our conversation here today. And I think that's kind of a beautiful thing, but yeah, to kind of add to that as well is don't be afraid to ask different questions with whoever you're working with. They should be able to answer them. And if not, they should be honest and say, I don't know. Maybe they'll say, I don't know, but I'll figure it out for you, kind of thing. But then also, just kind of being careful of, understanding with different practitioners, like what words are they saying and like, what does it actually mean? And are they being just kind of like generic, like how well do they know their stuff, and all those kinds of things.
Yeah.
But then also, like, in general, there's practical things where there's different practical approaches of, like, a lot of this doesn't even necessarily need to have to do with a doctor and his heart or mindset or anything. It could just be his vehicle that he's using. And like what we've talked about is, labs can be important. We'll run them occasionally here, depending on just what numbers we want to see with things. But as far as actually figuring out what's going on, we find that a really good history and just understanding how the body works and what causes different issues. And we get that through our training and through time and through practicing over the years with hundreds of patients. But then also, like, the muscle testing we find to just be amazing. I tell people muscle testing is the best thing in healthcare and nobody knows about it. And patients, after they have a couple visits, they always agree. They always agree because they actually feel like they're getting the most thorough and accurate assessment for their body and then answers for actually what their body needs. So I think it's really, really exciting. Dr. Tim, I wish every doctor did muscle testing. I really do. Because I think that healthcare would be a lot better off. I think our system would be way better. And people would have a lot less frustration with care and doctors and all that good stuff. So Dr. Tim, I know we got to wrap up here. I'm rambling a little bit. So any last words for this conversation for our listeners or anything else on the topic?
I think that's it.
Cool.
Just be wary. Know what you're getting yourself into. Talk to people, ask questions. That's my best advice. So, but let's wrap things up. So I'm Dr. Tim Augustiniak down here at Flourish Functional Wellness Center in Bentonville, Arkansas. If you want to find me online, my website is draugustiniak.com, draugustiniak.com, or flourishfwc.com. On there on the homepage, I've got links to all the socials as well as all the contact info. And if you have any questions, comments, concerns, or suggestions for future episodes, feel free to reach out. Thanks, guys.
Love it. And I'm Dr. Joel Miller. The practice here is Freedom Health and Wellness in Flower Mound, Texas. The website is drjoelmiller.com. And then you can find me on Instagram and YouTube as well, guys. Thanks for listening, guys. This episode was a little bit different, and it was more of a conversation rather than maybe a teaching kind of thing. But I hope this was helpful, and I hope this maybe sparked some different ideas, maybe gave you a little bit of encouragement as well, that you're not alone in all of this. Guys, I hope that this has been helpful again, and we'll see you guys in the next one.